Hello, welcome to another edition of OT Education and Wellness. I am your host, Jervin Arquero, an occupational therapy student. I will be sharing with you some medical insights and important information about rheumatoid arthritis. In today's video, we will be discussing what rheumatoid arthritis is, the scientific cause and effect of this condition, and the interdisciplinary team involved in providing the best quality care to treat and manage your rheumatoid arthritis. In addition, we will also explore how rheumatoid arthritis can impact your daily performance with everyday activities and tasks that are important to you, and what role does occupational therapy play to treat and manage your condition. Rheumatoid arthritis is a chronic autoimmune disease that causes joint pain, swelling, and stiffness in the hands and feet. It is caused by an autoimmune inflammatory response in the joint lining of a genetically predisposed host, causing painful swelling and may lead to bone erosion and joint deformity. As depicted in this photo, we can see the difference between a normal joint and a joint with rheumatoid arthritis. The disease manifests as a synovitis, which is the inflammation of the synovial membrane that lines the joint together. This tissue is essential in producing clear fluid into joint for lubrication, allowing a smooth movement between each joint. In rheumatoid arthritis, the synovial cells secrete damaging enzymes that destroy the surrounding cartilage and bone. As a result, the joint begins to swell due to excessive production of synovial fluid and thickening of the joint capsule. This weakens the joint capsule, causing destruction of the cartilage bone, tendon, and ligament. In the end, scar tissue forms between the bone ends, causing the joint to become permanently rigid, immovable, and deformed, as seen in this photo. Some of the common symptoms of rheumatoid arthritis include pain, which can be classified as acute or chronic. Acute pain occurs during disease exacerbations or flare-ups. Chronic pain, on the other hand, results from progressive joint damage. Another symptom include fever, which is typically low grade, along with swelling and stiffness, especially during in morning due to prolonged stretch of the hand. There is also warmth and redness, which is due to the rheumatoid arthritis becoming inflamed, causing the joints to swell and become hot and tender to touch. Lastly is fatigue, which is due to lack of sleep or sleep disturbance that a person experiences at night due to pain. Prevalence. The onset can occur at any age. However, the prevalence increases with age. The peak incidence of rheumatoid arthritis occurs between 40 and 60 years of age, with the rate of the disease 2 to 3 times higher in females than males. Managing rheumatoid arthritis. Rheumatoid arthritis currently has no known cure. However, early intervention can be applied to prevent any form of progression. Some of the major goals in treating rheumatoid arthritis include reducing pain, swelling, and fatigue. Also, improvements in joint function and minimizing joint damage and deformity. Next is preventing disability and disease morbidity. Lastly, it is also important to maintain physical, social, and emotional function while also minimizing the long-term use of medication. Next, we will discuss the different drug medication used for rheumatoid arthritis. The first one we will discuss is the non-steroidal anti-inflammatory drugs or NSAIDs, which is typically prescribed by your doctor. This helps decrease joint pain and swelling, but does not alter progression of the disease. Next, we have corticosteroids, which helps produce rapid and potent suppression of inflammation with improvement in joint pain and also fatigue. Lastly, we have the disease-modifying anti-rheumatic drugs, or DMARDs, which is a class of drugs used to treat rheumatoid arthritis by blocking the chemical release of the immune system that attacks the joints, which also causes damages to the bones, tendons, ligaments, and cartilage. If the symptoms continue to worsen and rheumatoid arthritis has caused extensive joint damage, surgical intervention is frequently indicated to relieve pain and improve function. Some of the most common surgical procedures include synovectomy, which is the excision of the diseased synovium, tenosynovectomy, which is the removal of diseased tendon sheath. Both of these are performed to relieve symptoms and slow the process of joint destruction. Next is tendon repair and transfer, which is the relocation of displaced tendon, repair or ruptured tendon, and release of shortened tendon to correct hand deformities. Next, we have joint arthroplasty, which is reconstruction of joints, and arthrodesis, which is joint fusion to restore the joints. In order to provide the best quality care for caring and managing rheumatoid arthritis, a multidisciplinary team are all involved to help a patient manages their pain. Some of the team consists of a rheumatologist, who is the doctor who specializes in diagnosing and treating rheumatic diseases and prescribe your medication and refers you to other medical specialists to help treat your condition. Next, we have nurses who help evaluate and manage chronic and severe pain by providing patients with pain medication, warm compression, and pillow support. Psychologists help people with rheumatoid arthritis improve their quality of life through by teaching them healthy habits, improve their mental well-being, and teaching them self-directed techniques to learn different ways to cope with pain. Physical therapists will perform physical assessment that includes a functional assessment, range of joint motion, muscle strength tests, postural assessment, and gait training. Lastly, occupational therapists focus on helping you manage symptoms and improve daily activities that can be challenging due to rheumatoid arthritis joint pain. Due to the progression and severity that rheumatoid arthritis could cause in the hand joint, it may negatively impact many adults during work years. This could stop individuals from working as the disease progresses. More importantly, it causes difficulty with hand function, affecting anyone in performing their basic daily activities, such as bathing, feeding themselves, brushing their teeth, preparing a meal, and grooming their hair. When rheumatoid arthritis limits a person from doing the things that are important to them, this is where occupational therapy comes into play and to help them manage their condition and improve their ability to function in daily activities. Occupational therapy evaluate and create a treatment plan intervention that caters to you and your needs. Some of the general objectives of occupational therapy includes maintaining or increasing ability to engage in meaningful activities, maintain or increase joint mobility and strength, especially in the hands, maximizing physical endurance, protect against or minimize the effects of deformity, increase understanding of physical, functional, and psychosocial effects of the disease. Lastly, they help a person mentally adjust to the disability. Next, we will discuss the different treatment methods that are useful in the remediation of clinical and functional deficits caused by rheumatoid arthritis. The first one is the physical agent modalities, or PAMs, which may help to relieve pain or maintain and improve range of motion. Some of these examples include hot packs, paraffin wax, fluidotherapy, hydrotherapy in a heated pool, and ice packs. Next is we have therapeutic exercises, which helps with keeping muscles and joint functioning as normal as possible by maintaining muscle strength, preventing disuse atrophy, and improve range of motion. Lastly is client education. This is one of OT's bread and butter as it has been shown to empower clients and lead to positive changes in pain reduction, psychological status, disease management, self-efficacy, and overall health promotion. Some of the example clinical education that OT provides is symptom management, joint protection, and fatigue management. There is a study by Sagal et al. Examined the efficacy of occupational therapy-related intervention for adults with rheumatoid arthritis. The study discovered that therapeutic exercises such as resistive, aerobic, and dynamic exercises has resulted in significant reduction in disease activity. It also improved pain and function and increased muscle strength and walking ability. The same study also revealed that client education, such as self-management and home exercise program, demonstrated significant better function, self-efficacy, disease measure, and improvements in pain. The other occupational therapy treatment for rheumatoid arthritis also includes therapeutic activity, which applies the same principles as therapeutic exercise, which could offer enough repetition of movement to help improve hand range of motion and strength. An example would be knitting or crocheting. Next is rest and sleep, which is an active means of reducing the inflammation and pain in the hand. Though for some people, it could be challenging, especially if pain could be exacerbating and could potentially lead to depression. Next is splinting, which can be useful to reduce inflammation, decrease pain, and it also supports unstable joints. It also provides proper positioning for joints, and it also helps increase range of motion. Lastly, occupational therapists are known for educating in the use of assistive device. Assistive device can help compensate for the loss of range of motion and strength. An example would be an occupational therapist giving a patient extended handle devices such as a reacher, bath sponge, shoehorn, and dressing stick. Also, they could provide them with built-up handles to compensate for limited hand function, such as built-in handles for toothbrush, hairbrush, eating utensils, and writing implements. Lastly, another study by Pozmahova et al. Performed a study that explores the effects of occupational therapy treatment in a comprehensive rehabilitation programs with patients with early rheumatoid arthritis. This study demonstrated the use of the program focusing on position treatment, training on how to protect joints, preventing the formation of deformities, uses special exercise equipment to restore fine motor skills, and also helps strengthen fine coordination of wrists, and also perform set of exercise to maintain joint mobility. The comprehensive rehab program assisted in improving functional conditioning, working ability, and tolerance in household stress, resulting in a positive effect on professional, social adaptation of a patient with early rheumatoid arthritis. That concludes my presentation for today. Thank you for listening, and I hope that I have given you enough education and understanding about rheumatoid arthritis and how occupational therapy can make a difference in your life.